Thank you. Katie and I really are very appreciative of being invited to speak with you today. Before we get started, we would like to recognize those at the heart of our stroke programs, our fellow stroke coordinators. So those that are with us in person today, could you please stand to be recognized? Without you, our programs would not be as a success as they are. So thank you to our stroke coordinators. Please rise. All right, we would be remiss if we did not take a moment to recognize the inspiration behind Stroke Smart. And that inspiration is in loving memory of Grandma Rose. So Alan Stillman created the concept of Stroke Smart in loving memory of Grandma Rose, who tragically passed away when Alan was 12 years old. Grandma Rose suffered from a catastrophic stroke, and his mother failed to recognize the signs and symptoms of stroke. Grandma Rose laid in her bed for 24 hours before medical attention was sought. After Grandma Rose passed away, sorry, Chad, I'm seeing the comments. It's distracting. After Grandma Rose passed away, Alan's mother tragically ended her own life, and Alan entered the foster system. But this was not the end of his story, but yet the beginning of his story, where Alan decided to have a vision that he could prevent other families from experiencing the same tragedy that he had experienced by simply educating those on what the symptoms of stroke are and what to do when they occur. And it reminded us of this quote, that vision without action is merely a dream. Action without vision is merely passing time. But vision with action can change the world. Alan, you're certainly changing the world, one stroke smart city, county, country, state, and ultimately world at a time. We thank you. The Maryland stroke facts. So we know, as most stroke coordinators know, that stroke is the 5th leading cause of death in the United States. But in Maryland, it's the 3rd cause of death. The Maryland stroke death rate is 81 per 100,000, higher than the national rate of 73.1. We as a state have inspired, encouraged, collaborated, and challenged each other to achieve record-setting door-to-needle times. I'm sure LifeBridge Sinai is here. They once set a record-setting door-to-needle time of less than 10 minutes during our Golden Brain Challenge. Treatment within 60 minutes has quickly become treatment within 30 minutes as the new standard, and our programs have responded well to this challenge. When our patients arrive at our doors, we have significantly decreased arrival to treatment times. But there's a metric that hasn't changed in over 20 years, and that metric is when our patients arrive. Last known well to arrival hasn't moved. So as a state during calendar year 2021, less than 30% of patients suffering from acute stroke arrived within 4.5 hours of last known well. When greater than 70% of our patients are arriving outside of the thrombolysis treatment window, how can we possibly impact preventable long-term disability? Over 300 patients in our state arrived 1 hour too late. Now, before the neurointerventionalist, Dr. Singh, in the room, get upset with me about calling the treatment window 4.5 hours. We recognize, for the purposes of this presentation, we will speak last known well to 4.5 hours as the treatment window. But we recognize the expansion of treatment up to 24 hours. Would you join me in also recognizing that not all acute strokes are ischemic strokes, and not all ischemic strokes are large vessel occlusions? The emphasis on early arrival within 4.5 hours ensures patients suffering from acute stroke are offered all treatment options they may be eligible for. As we continue our presentation, our ask is that you reflect on the following question. What if we pursued onset to needle with the same passion that we pursue door to needle? There's an action that we can take now. Stroke Smart is a community-based public health campaign to reduce pre-hospital delay for stroke treatment. The focus of Stroke Smart is to reduce pre-hospital delay by targeting last known well to 911 call. A study showed that half of all stroke patients are driven to the emergency department by family or friends. This prevents the emergency department from being ready to receive the patient and having the providers necessary and the systems ready for treatment. EMS use is known to have additional benefits beyond shortening pre-hospital time. EMS use is associated with prompter imaging, shorter door-to-needle times, and increased thrombolysis rates. One study found that when cases where EMS was activated, only 4.3% of calls were made by the patient. 60% of calls were made by family members. This emphasizes that targeting family, caregivers, coworkers, and community members is an important part in our stroke educational programs. Lack of patient knowledge regarding stroke symptoms and how to most appropriately respond to them is the number one reason of pre-hospital delay. Studies have shown that 39% to 75% of the general population is unable to name a single warning sign of stroke. Perceptual and behavioral factors such as symptoms not taken seriously or low threat perception are also associated with delayed arrival. However, the knowledge of treatment options available, particularly the time of thrombolysis treatment, is associated with early arrival, which emphasizes that we need more than just improving stroke symptom knowledge, but that effective treatment exists and good outcomes are possible by directly calling 911. So let me tell you a little bit about Frederick County. My Frederick Health Hospital people are here on the end. Hello, ladies. Frederick Health is a population of 280,000 people. We're the largest county in Maryland in terms of land area. The city of Frederick is home to over 78,000 people and is the second largest Maryland city. Do you know our national anthem, the Star Spangled Banner? Written by Francis Scott Key, born in Frederick, Maryland. So sometimes we are known as Key City. We thought, like many of you are thinking right now, couldn't be us. That's a Baltimore City problem, Eastern Shore problem, Montgomery County. Couldn't possibly be Frederick County. But it was us. It is us. What are we going to do about it? As you look at the height of COVID 2020, 17% of our patients arrived from last known well within 4.5 hours. 2021, 22% of our patients arrived. This was our call to action. So we're inspired by this quote by Leonardo da Vinci that says, "I have been impressed with the urgency of doing. Knowing is not enough. We must apply. Being willing is not enough. We must do." At the height of a competing public health campaign, COVID vaccination, we found little, if any, support from our community partners to tackle an additional public health message like Stroke Smart. We were passionate and persistent. Stroke is the third leading cause of death in Frederick County. We thought about legislation. Should we propose a law that stroke warning signs must be posted in all of our county government buildings? But that felt a little too dramatic. So Alan Stillman presented us the right direction. He said, start with a proclamation. And so we did. We partnered with County Executive Jan Gardner to write a proclamation declaring Frederick County as the first stroke smart county in the nation. This proclamation served two purposes. It was a written commitment to our community that we would act, as well as the support we needed to engage our community partners. With this piece of paper, we were able to revisit our community partners and say, the county executive has said it is so. The county executive declares that all Frederick County public and private schools will be encouraged to make Stroke Smart training a part of their training for all students, teachers, staff, and families. The county executive says the goal is to educate everyone in Frederick County about stroke recognition and the importance of calling 911. Was a single stroke coordinator for a county of 280,000 people, we needed a system in place. Couldn't possibly be done by one. Businesses, organizations, communities encouraged to participate and contribute to Stroke Smart. So we thought to ourselves, what would the impact be if the governor said it was so? So our Frederick County Stroke Smart partnerships included our Frederick County Senior Services Division, Frederick County Government, Frederick County Health Department, Frederick Health Hospital, and Frederick County Public Schools. And we collaborated with these organizations to begin our Stroke Smart Frederick County approach to build Stroke Smart champions, individuals and community partners to help the community at large become trained as Stroke Smart. And we began with Frederick Health Hospital as the second largest employer in Frederick County by providing hospital-wide stroke training. And then we approached Frederick County Public Schools, where there currently was no stroke education for students. And so they developed a curriculum for their secondary health education programs, which began this school year, where middle school students would receive stroke education during their health curriculum. And then we began work on a Stroke Smart public service announcement, showcasing the faces and places of Frederick County in both English and Spanish. And then we began work on Stroke County government training, where all government employees would be required to complete stroke education training annually. And then lastly, our Frederick County Health Department Stroke Smart webpage, so that businesses and communities and organizations willing to be stroke smart had resources to do so. And our goal was to increase the number of patients arriving to the emergency department within the treatment window to ultimately decrease long-term disability. And with the success of this program, Stroke Smart Frederick County, I reached out to my colleagues at Maryland Stroke Center Consortium and partnered and said, if Frederick County can do it, what's preventing us from Maryland doing it? And so Katie will take you on our journey to Stroke Smart Maryland.
Good morning, everyone. So I'm really excited to share our journey to Stroke Smart Maryland. The journey is not finished by any means. In fact, it's only just beginning. And as I share this journey with you, it's going to be followed by an ask. And I know you all are sitting on the edge of your seats, but I promise I'll share that ask at the end. We all know that Maryland has done an excellent job of improving access to high-quality stroke care. We have 39 MIMS designated stroke centers across our state. 33 are primary stroke centers. There's 3 thrombectomy capable centers and 3 comprehensive stroke center. There's also an acute ready stroke center designation that's become available recently. And we do have centers that are pursuing that designation. So access to quality stroke care is going to continue to increase. The Maryland Stroke Center Consortium is an informal organization of all the stroke coordinators across the state. Myself and April had the privilege of chairing and co-chairing the MSCC over the last year. One of our goals was to increase the impact that the MSCC has on stroke care across our state through providing some structure to our efforts. Thus, the Maryland Stroke Center Consortium Infrastructure Development Task Force, otherwise known as the MSCCID, was formed. I'd like to take a moment to recognize all of our MSCCID team members for their hard work. Starting late last year, we began meeting every 2 weeks to put our minds together to figure out how we could really make an impact. So thank you to all of our task force members, and I'm going to call them out right now, starting from the top left to right. Thank you to Nicole Leonard, Chad Schreier, Sharon Harrison, Debbie Heckler, Barb Truitt, Karen Gonzalez, Melissa Kaler, Fiona Burke, Nikki Miskell, Shelley Stein, and Mr. Alan Stillman, who is not a stroke coordinator, but the founder of Stroke Smart Virginia. Throughout this presentation, I will continue to acknowledge the noteworthy contributions by all of our team members. One of the very first things we had to do was go back to the early stages of the MSCC and remember why we were together in the first place. The MSCC already had a slogan, thanks to Ms. Barb Truitt: excellence through collaboration, not competition. And I'm just going to say that one more time. Excellence through collaboration, not competition. It was time to develop a vision and mission for the MSCC. So we did just that. Our vision is leading Maryland to become a state where all citizens receive robust stroke prevention and advanced high quality care. And our mission is to collaboratively use current research and guidelines to strategically deliver excellent stroke care, preventative education, and support across Maryland. We also had to establish goals, or what we were going to focus on. So we knew that we wanted to raise awareness of stroke signs and symptoms to ensure Marylanders arrive to the hospital within the treatment window. We wanted to influence Marylanders to reduce their stroke risk through community outreach and education. We definitely wanted to drive advancement in acute stroke treatment across Maryland through the adoption of evidence-based care practices to improve patient outcomes. And we wanted to collaboratively develop and maintain processes to facilitate patient transfers to stroke centers in Maryland to improve access to care. We already did a lot of this really well throughout our state. There's groups that work on providing community outreach and education. We work within our hospitals to drive advanced stroke care, and we collaboratively create processes and work together to streamline patient transfers. But as April mentioned before, we have not shifted the needle on last known well to arrival time. So this became our grand focus. And our endeavors to Stroke Smart Maryland began. Our very first move was to connect with Mr. Alan Stillman, founder of Stroke Smart Virginia. Mr. Stillman has taken the time to develop standardized processes to become Stroke Smart as a city, county, or state, medical office, retirement community, school, business, and faith organization. He's also laid out steps for any resident to become a Stroke Smart champion. The goal of all of this is to begin to educate our society on the signs and symptoms of stroke and the importance of dialing 911. So our stroke timeline begins with Frederick County, Maryland becoming the first Stroke Smart county in the United States, thanks to April. April did a great job of highlighting efforts in Frederick County and showing the momentum of the ripple effect that has been made through support and action. The same effect can be replicated throughout all of Maryland. In February of this year, La Plata, Maryland was proclaimed a Stroke Smart city. And that was thanks to Shelley Stein. I'm excited to announce that in May of this year, Governor Larry Hogan proclaimed Maryland a Stroke Smart state. I'm actually going to take time to read the proclamation to you all because I think it's very important for this audience in particular to understand the full scope of the proclamation. So this is a proclamation from the governor of the state of Maryland. Whereas 1 in 6 people will have a stroke in their lifetime and 80% of families are affected. Additionally, stroke is the leading cause of long-term disability, putting a tremendous financial burden on individuals, families, as well as society. Whereas Maryland public and private schools will be encouraged to make Stroke Smart, Spot a Stroke, Stop a Stroke, Save a Life part of their training for all students, faculty, and families. And whereas all Maryland health and safety focused entities such as hospitals, clinics, physicians' medical practices, health departments, pharmacies, fire, EMS, public safety, social services, and the departments of aging and the Maryland Stroke Center Consortium will be urged to participate in improving Maryland stroke literacy to educate all its employees, volunteers, and associated communities. Whereas Maryland community, including businesses, civic organizations, senior communities, faith-based organizations, and inhabitants will be encouraged to participate and contribute to the Stroke Smart, Spot a Stroke, Stop a Stroke, Save a Life campaign through active citizenship efforts. Whereas the goal is to educate everyone in the state of Maryland about stroke recognition and the importance of dialing 911 immediately, and therefore reduce the onset of stroke to 911 interval to be measured by EMS and local hospital systems, and make Maryland a model for other communities, citizens, counties, commonwealths, and states, as well as the nation, thereby advancing the vision of a Stroke Smart America. Guess what happened after that? The work continued. So Westminster, Maryland was declared Stroke Smart in August, thanks to Melissa Kaler. And Carroll County was declared a Stroke Smart County in October, also thanks to Melissa Kaler. With all our efforts, we needed a way to sustain the movement that had only just begun. I'm happy to announce that following Governor Hogan's proclamation, the Maryland Institute of Emergency Medical Services Systems, otherwise known as MIMS, agreed to offer us real estate on their website to create a Stroke Smart Hub. A brilliant idea and suggestion by Debbie Heckler. This was also taken to MIMS leadership by Anna Aycock. In addition, Mr. Alan Stillman continued to work with us and provide his resources and templates on how to become a Stroke Smart place or champion. So now we have a Maryland-based Stroke Smart Resource Center to provide guidance to anyone seeking to become Stroke Smart. I also have to shout out Kelsey Hood at MIMS for building the Resource Center. She did an amazing job and the site looks fantastic. I'm hoping that all of you will have an opportunity to take a look at the site and start directing people to the Resource Center. There is a QR code there. Please grab your phone, scan that QR code, and it will take you directly to the MIMS website, to the Stroke Smart Resource Center. So with that, it's time to adopt a new focus. I want you all to think about what would happen if we pursued onset to needle with the same passion and vigor that we pursue door to needle. Then we could see an increased number of Marylanders arriving within the treatable time window for acute ischemic stroke. We'd see an increased number of Marylanders receiving treatment for acute ischemic stroke. And we could see a decreased preventable long-term disability amongst Marylanders due to stroke. It's time to chase a new metric. So remember, at the beginning, I stated I was going to be sharing an ask. Are you all still on the edge of your seats? Will you join the journey to Stroke Smart Maryland? Thank you.